Hello, everyone, and welcome to another Storm Robotics production. This is the Shientist, and this is going to be an audio podcast on educational support surrounding chronic kidney disease, and it's all about the Enquiry. And this is part of the Molecular Storm Gauge V.2 audio podcast series, and I'm going to provide an overview in an abstract format relating to some research that has been done collaboratively between the Renal Patient Support Group, the RPSG, and in part the Kidney Disease and Renal Support Group, or KDARs for kids, and also between two academic institutions, and also colleagues or collaborators that have been working at different hospital or otherwise known as NHS Trust, National Health Service hospitals. One based in the southwest region, the North Bristol NHS Trust, in the southwest UK, and also in relating to colleagues from the colleagues or collaborators that worked on this are also from the United States, and also a colleague and collaborator from the university, from another academic institution from the Scotland region. So there was so in total there were three. So sorry, I made the mistake that there was two academic institutions involved, when actually there were three academic institutions involved, and two social media platforms, and colleagues, collaborators from an NHS hospital site as well. So I'm going to read the abstract around this, and the full works will be available again once the full works will be available through the Renal Patient Support Group, or the RPSG, in due time. So a bit of introduction to this work, through this research first. This is where in introduction, an estimated 15 million patients in England or in the UK have at least one long-term health condition with a prevalence of chronic kidney disease, for example, CKD, rising. Understanding educational support can help navigate between healthcare sectors. So what the research team are doing here, we're looking into trying to understand how patients and carers, really, in some regard, could be better supported through educational, from an educational stance, so that the healthcare that patients receive are actually more integrated between different health sectors. So there was a main research question, and that was this. The research question was to seek to understand educational support surrounding chronic kidney disease, and there was an ethics application process that took place with this, and so the research was approved by a research ethics committee based in Greater Manchester South Research. It was a Greater Manchester South Research Ethics Committee, and there is a project ID around this as well. The peer review work will have a final, will have that full information as I'm led to understand. The methodology around this was where qualitative methodology was implemented, and aligned to qualitative methodology, an inductive content analysis approach was used in particular to gain a sort of a rich understanding from the participants who were recruited to help the research team to answer particular questions. So the approach or inductive content analysis is particularly effective in linking theory or framework as well. So that's why inductive content analysis was implemented. Now with this research, or part of this research, a few intriguing activities also took place that linked with this, and that was where the two social media platforms, or the leads for or on behalf of the two social media platforms, they together hosted or were involved in developing ideas through the implementation of two workshops, and the two workshops took place aligned to what's referred to as patient and public involvement. So two workshops took place in May and June 2019, where particular topic tagging activities were co-developed between the RPSG and KDARs platforms. And these topic tagging activities are actually activities that allow those members who are part of who are part of the social media platforms on KDARs or the RPSG, when they post particular subjects that they want to sort of share understanding or get perspective from. For example, what happens is that the topic tagging allows the moderators or the administration, the admin team for these two social media platforms to actually put these topics, topics that are shared through the social media platforms into particular topics that are relate to specific areas of healthcare. Again, the full peer review works has more around the activities that took place and what and the justification for the topic tagging activities. I'm now going to just run through a little bit about the sampling and the recruitment. So 19 participants between 4 cohorts were actually approached and involved to participate in what is known as qualitative research interviews. This included 6 general practitioners from primary care, 4 healthcare scientists, 3 nephrologists or clinicians, and 6 patients with chronic kidney disease with chronic kidney disease at various classifications. And they were recruited and they participated, whereby they were answering particular questions through telephone interviews. The telephone interviews were my understanding is the telephone interviews were in the region of 30 minutes to 40 45 minutes, depending on the cohort that was being approached at the time. And the results around this were that nine main themes and several sub-themes were identified when coding for health professionals, and 9 main themes and several sub-themes were identified when coding qualitative data for those patients who had chronic kidney disease and who participated. So in line with this, there's an overall sort of conclusion with relating to what the analysis sort of provides, and that is to say that there needs to be a coordinated. So the conclusion, this is the conclusion part. There needs to be a coordinated effort between patients and professionals or health professionals to understand how chronic kidney disease education could be more integrated at point of care and in line with public health. If anyone is going to follow up this work or look to find a literature that relates to this work, there are particular terminologies that can be searched, can be used and used for search through particular databases or search engines, and that includes the main sort of terminologies include nephrology, education, and qualitative research, and patient and public involvement, and a combination of those words into particular databases or search engines would help identify particular literature that focuses on this particular work. So I'm going to just leave it there. This was just a kind of an overview, and I've been fortunate to have the abstract made available through my colleagues, and I wanted to share this through an audio and podcast. Once again, this has been the Shientist. This has been a Ztorm Robotics production, and this has been audio podcast on educational support surrounding CKD, and this is all about the Enquiry, and hopefully I'll be doing another audio podcast soon in this series. So I hope to catch you a bit later. All right, thanks then. Bye.